My name is Prof Depfenhart. I'm a plastic surgeon by training. I'm from Germany and I'm an extraordinary professor at the Noordwes-Universiteit and the Walter Sisulu University. I've been in the field of peptide and protein design for quite a while, and also nucleotide design. And in the early pandemics in 2020, I was challenged by a Swiss investor guy that I have been knowing for a long time, and he asked me if I cannot do a vaccine. And now one has to know that this guy is very much into Africa. He loves Africa, and he was very much afraid of that Africa will be the last in the queue when it comes to vaccines. And so he asked me if I cannot do something. I was at that time a bit irritated, I must say, but also tempted, because scientifically it's a great challenge. And first I told him, what should I do? So I know I do protein design and so, but a vaccine is something totally different. And he asked me and said, but Marcus, you're doing things like this. What is different here? Can't you do it? And then he said, I will pay for everything. And then I said, okay, maybe we should look into it. And so it's how it started. And so after a while, I looked very much into vaccine design and found out that it's really not so far away from protein design. And one has, of course, to learn a lot about the immunological parts and so. But then I came up with a vaccine candidate, and at that time, unfortunately, the guy was not interested anymore to follow up because the big companies were already in the field. And so I came to the Noordwes-Universiteit, and they were very interested in trying that vaccine candidate, and so we did. And from this, we started a nice collaboration that now took us to further vaccine candidates, and this is what I would like to talk about later. So the first vaccine candidate was a vaccine against COVID-19. So now COVID-19 is more or less gone. No one really knows if it's gone, but it's not a real topic for us anymore. For us, African diseases are a big topic. And for us, it's also important to build capacity, to build skills in Africa. And that's why I always say, in Africa, by Africa, for Africa. We want to do that internationally. We want to collaborate internationally, and we are already collaborating. So we just recently did an animal trial in Germany with our new vaccine candidate for TB. That's one of our main interests for now, but we also will look into malaria. But for now, we are focusing on TB. And TB is really an issue. TB is one of the big pandemics. It's a bit neglected as pandemic, but it's a pandemic. 1 person out of 3 is actually having TB in the whole world, so it's a huge problem. It's actually much bigger, that problem, than COVID-19. So we really are facing an issue here globally. Also in Europe now it comes back. So we have a lot of TB in the Ukraine. We have TB in Russia. And now through the movements of all those people, we also see it in Central Europe now. And so there is a big demand for the whole world actually to look into TB, but especially for Africa. And that's why we want to do something against African diseases. TB is our focus now, but also there is dengue, there's malaria. So there are different ones. There's still a lot to do for us, but we really want to develop something that can help the African people or people in other countries worldwide, especially in the third world countries, where they don't have access to the most fanciest medicines. And this is what we are doing now. So I have actually a very long relationship to South Africa. So I came here first in 2003. I did an elective at Tygerberg Hospital in Cape Town. And I fell in love with the country, with the people. So I still feel very much related to South Africa. And this love is an ongoing love, so that lasts till today. And so I'm very happy that I can contribute now. And that was the reason why I also donated the use of my platform that I developed for those kind of vaccines to be used in that project and to hopefully make it into the market and to help to heal a lot of people, actually, and to prevent diseases in Africa. We just recently finished an animal trial with our collaborators in Germany, and I'm very excited. We are very excited. So we have outstanding results, and this is now a bit like a spoiler here, but our TB vaccine seems to perform very well in the animals, and we can't wait to test them now in a challenging model. That means the animals get infected, and we see how protective the vaccine actually is. And this will be the next major step, but from what we see now, we are very confident that this will also lead to very nice results. And this is only the starting. So it's really amazing what we see when we see the in vitro results. We have actually 2 groups working on the in vitro results. So first there was one group doing the in vitro work. Now there's another group doing the in vitro work. And it's getting better and better. We see fantastic results in vitro. We see very promising results in vivo. And we really hope that we can translate that into a vaccine that makes it into the market at the final end. And not only for tuberculosis, what is a huge issue, but also for other African diseases. So with that platform technology that we are using, nothing seems to be impossible. And we are really very excited, and we can't wait to really build up something sustainable here in Africa. And we are also looking into setting up an institute, or let's call it a chair for vaccine design, vaccine development. And this is not only about vaccines. I don't like the term vaccine at all, because vaccine always gives you the feeling of dealing with infectious diseases. But we are not only talking about infectious diseases. This goes much further. This goes into gene therapies. This goes into autoimmune diseases. So in future, we will probably solve a lot of problems with just getting an injection. And this is where we are working on. And we don't want just to stay with infectious diseases. Actually, we are very ambitious here, and we really hope that we will change the world a bit. And we are on the forefront of this. It's very difficult to explain. We are now in Africa, but we are on the forefront of something globally. And we can really develop game changers here. And that's what we want to do. What is also very exciting is that we see now that all these countries and all these institutes are working together. So there's that great collaboration between the Noordwes-Universiteit and the Walter Sisulu University on the one side, but there's also a collaboration with Germany, with Europe, and there's a further collaboration with the OR Tambo chair, Tanzania, Uganda, Rwanda. So it's amazing how now these people all work together and how they share one vision, one mission, and we are really on the brink to something big, and that's really enjoyable, I must say, and it's also exciting, and we are convinced that we can make a change, and that's personally exciting for me, especially as a plastic surgeon. It sounds like I'm a bit wrong in that field, but I must also share this vision with you. Because I think in future, maybe in 20 years or something like this, one will say, how could you do that to those people? Why did you do a facelift? And why did you pull off the face? And it's so cruel. You can do it with injections. And I really think this is where we are going to. Everything will be, to solve the issues, it's just working on a very molecular level, on a biochemistry level, and that's very exciting, and we are working on this. We're starting with infectious diseases, but I'm pretty sure we will come much further down the road. So in order to fulfill our ambitious vision and mission, it is of course necessary, and we are open to extend our network to other collaborators globally. And so we want to invite others to work with us and to join us on that really exciting journey, and we cannot wait to go on.